For many of us, it is the most important commitment to take care of our loved ones. We need, we feed, as the Beatles song goes, and we work hard to ensure that those close to us are thriving. We do this often without training, support, or even knowing that we've become caregivers. Today, there are 53 million people taking care of their parents, neighbors, or friends. And there are 53 million stories. From the Stanford Center on Longevity, this is When I'm 64, the podcast for caregivers. I'm your host, Ken Stern. Today, we talk about the power of technology to make a difference in the lives of caregivers and their loved ones.
Tap 1, tap 7, go home. Sorry, that's how I talk to my phone.
That's Harry Wittenberg, getting ready to record this interview at his home near Oakland, California.
I'm telling you, the voice control.
He's giving voice commands to his iPhone, as he is almost completely paralyzed with ALS, a disease that started to take over his central nervous system 3 years ago. That noise you hear in the background, it's a ventilator that helps him breathe. Harry is an early adopter of new technologies that have allowed him to retain many aspects of his independence. He's one of the first to use eye gaze technology in the Bay Area, allowing him to operate his computer and his wheelchair using only his eyes. We talked to Harry and his wife and primary caregiver, Mary Ann.
I met Harry here in California. I'm originally from Massachusetts, and after college and graduate school, looking for an adventure, came out to the Bay Area where I had friends, and several years later I met Harry. Harry and I were both actually working, he was a special education teacher at the time, and we were both working at a middle school in Oakland, California. So we met, and I was a teacher also, and so we met that first year when he was here in Oakland. And the rest is history. We got together and got married and had kids.
We're going to have our 35th anniversary.
Right. On next Tuesday.
Next week.
Be 35 years.
Harry admits that one of the most important qualities, not only for a happy marriage, but for weathering the ups and downs of ALS, is keeping a sense of humor.
The thing is that, humor also disarms people. And, we have and lots of our friends have also very good senses of humor, and we don't hold back, kidding each other about things.
Well, Harry refers to himself as the boneless chicken. You remember the old Gary Larson cartoons?
Yeah.
So we use that a lot.
But humor does sort of disarm people. It makes them feel much more comfortable around you. Certainly with, even with our own kids, we're very light, in terms of this whole thing. They know what's going on, they're happy to take care, but it's not a barrier to our relationship. Trying to hit that sense of normalcy, is what I try to do for myself. And, keeping it going like that just kind of tears down those barriers for, because I don't want any pity. I don't have any self-pity. I want people just to see me as who I am.
I asked Harry about what he was thinking when he discovered he had ALS.
For quite some time, Marianne and I would walk our dogs early in the mornings. And slowly, I started noticing that my right foot was sort of dropping. In other words, I was kind of losing control of my right foot. Now, for a while, for years, because I've always been pretty active, an active cyclist for many, many years, then I kind of wore my knees out, so I had arthritis in the knees, and I thought, well, maybe it was time for like a knee replacement. And maybe that was part of it. And so I first went to an orthopedist who said this is not a muscular thing, which then sent me to get a CAT scan to see if there was, if this was MS, if there were lesions, and then finally to a neurologist who then did a very painful electrical, I guess it's an EEG or an electrical, stimulation test, which is pretty much the only way that they could really show that, you're sort of losing control of your muscles, that the nerves are dying. So I got my original, sort of the first test was in November, but the official what I think was in January of 2018, which that was the official diagnosis. And at that point, I started getting very, very weak in my legs because it started in my lower extremities. So it's like I couldn't walk up the hill anymore. And then, I couldn't keep myself up. So I started using like walking sticks. And I was still going to work, taking the train, taking the BART into San Francisco, would go to work. And then it went from a walking stick to two. Then it went from that to a walker. And then at some point I couldn't even hold myself up anymore. So that's when I had to get into a manual wheelchair. And then from there I progressed to a power chair. The news was devastating for us. I mean, Mary Ann, she'll certainly speak to this, but was determined that this was not really, this was not the right diagnosis, that there must be something wrong. Because these things come out of nowhere. I mean, literally, one day I was very healthy. 6 months later, I could hardly walk. With no, other kinds of markers, any other indicators, I was perfectly healthy in every way. So ALS, is obviously a very devastating disease. It's terminal. So it really did hit us very, very hard. But at the time, I wasn't that physically disabled. It was just at the beginning, so it was more, I guess, anticipatory. At that point, like, how long will this take? For some people, it goes fast. For some people, it goes slow. It's a very unpredictable kind of disease when you try to predict progression. So yeah, it was pretty devastating. And it took us a little bit of time to tell our kids once we really knew what was going on.
Harry, you write a blog, which we've all read portions of it and admire, called The Miracle of Technology. Tell us about why you call it the miracle of technology and sort of how it's changed your life.
I've always been sort of an early adopter of technology. I've spent many, many years working at high-tech companies. So I've always, enjoyed the challenge of trying a new technology, seeing what it could do. So I always had a penchant for that. But as I started losing function, I started to want to maintain as much independence as I possibly could. And slowly I just tried to, find technologies that would adapt to my level of functionality. At first, it was like using, because when I couldn't type anymore, I started using like a trackball because it was easier, because I still had functionality in my thumbs. So I was able to sort of use that. And I was even using a trackball on my phone, as a way to control my phone. Because, there are certain trackballs that could work with Android phones. So I started using that. And once, my fingers started slowing down and it was more difficult, then we were introduced through the clinic at CPMC with our speech therapist, eye gaze technology. But of course, I was kind of proud, wanted to keep with the solutions that I was using. But it was Mary Ann that really pushed me to really sort of start to adopt the eye gaze technology. In a sense, each technology that I found is a result of some loss of function that I somehow wanted to keep. And so for me, is then really starting to explore like what's out there that I could do to maintain my independence. So the eye gaze technology was one big one, because then I could interact with my computer, because it's basically just a virtual mouse. So, I'm able to pretty much do anything that I need to on a computer if I had a physical mouse. The one big thing that I also researched was this technology that now, using my eye gaze on my computer, I could actually control the functions of my chair. So I could drive myself again, and I could adjust my chair as needed without anybody helping me. So what I was just really trying to do, not just to keep my independence, but to try to not be so dependent on others.
So, Marianne, even in the 20 minutes we've known each other, Harry's identified himself as being a technology early adapter, and you've identified yourself as being not as current as he is. But Harry credits you with sort of pushing him, being more technology forward on adaptive technology. So tell us that story about how that happened and why you pushed him.
So as Harry was losing function, it became clear to me that these kinds of technologies would really help him, but we needed to get on it sooner than later, because there's a lot of, there's a learning curve, and he was not as enthusiastic initially, because he wanted to find, the least intrusive ways to still be independent. But I just knew how long and just the difficult process to acquire all of this and to learn how to use it, then I just kept on encouraging him. And so when I finally determined it is time, especially to go to that eye gaze system, once he was hooked. Once he saw how it worked, he was hooked. And then we kind of created a monster, and he started looking for all the other technologies he could use.
I'm curious, Marianne, what technology among the many that Harry uses has been most helpful to you as a caregiver?
I would say really the eye gaze technology has been the best. I mean, it's wonderful because it initially, before he started using it to drive his chair, just his ability to access his email and to be able to read books again, without having people set up or turn pages or any of that kind of support, to be able to write his blog. It keeps him. It allowed him to be engaged with the world and to keep his curiosity up, and I think it just makes him a much happier person. And I think because he is happier, it makes life a lot easier for all of us. Though he tends to be the most optimistic person that I've ever known. But just to see him engaged and enjoying, the life that he has now, it just makes it easier on all of us, because he is just a happier person, and a more involved person. And then when he started actually using it to drive the chair and to manipulate the chair, that just physically made it a lot easier for us, because we weren't always having to attend to him.
So, Marianne, I mentioned earlier that in the podcast immediately after this, we'll be talking with two experts on caregiving and technology. What would you ask them if you were in front of them, or what would you tell them about your needs and technology?
I think what is really important to me is the access to this technology. In this journey, Harry's been very fortunate to have this, because we could purchase it for him, and we, had the wherewithal to do the research and find it. There's somewhat of a disconnect in the supply chain from, I think, the technology that's developed, and and all of these wonderful engineers that are developing this, and then getting it to the people who really need it. Certainly the cost factor, it's a relatively small population, so I'm sure the profits aren't there, all of those problems. And then the other thing is the tech support, the follow-up. I fear sometimes there's probably a lot of closets that have this technology that's not being used because it's given to a patient, to a person, and then, it's a constant learning process. It needs to be repaired. It needs to be updated. And I think that kind of tech support isn't always there. People have to go looking for it. So I think the technology is great, but we have to make sure that everyone has access to it and that it works all the time for people.
One of the things you wrote in your blog, Harry, is that ALS has taken away some very important things in your life, but it's also given you so much. What did you mean by that?
Well, to me, it's really mostly about the relationships that I have with my friends in my community. It's people have really rallied. They've really showed their support, and their love, and it's just been, much more intense than it used to be. And so, when you get that kind of outpouring, of love and support and closeness, that really shows. That was really a big thing. That's, I guess, if anything, that's what it gave me. That sense of, closeness, and even with my own kids, their now awareness and understanding what this is, I think has brought us all closer together.
Mm-hmm.
Harry, Marianne, thank you so much for spending time and sharing your stories with us. Really appreciate it.
It's our pleasure.
It's our pleasure, yeah.
Yeah, no, it's a privilege to talk with you. Thank you so much. That's Harry and Marianne Wittenberg. Joining us now to help us better understand the implications of the changing landscape of technology and caregiving is Carrie Olson, the Chief Innovation and Technology Officer for Front Porch and President, Front Porch Center for Innovation and Wellbeing, and Ken Smith, a Senior Research Scholar and the Director of the Mobility Division at the Stanford Center for Longevity. Thank you both for being here. Ken Smith, let's start with you. We're talking about assistive technology. Can you define that for us and tell us how it's used in the caregiving world?
Sure. Well, I can certainly give you my definition of assistive technology. I think, and it tends to be pretty broad. I think when most people use the term assistive technology, they're often referring to devices or systems that help people with disabilities. I think that's probably the way it's used in the caregiving world. I like a somewhat broader definition myself. I think any technology that helps somebody counter the effects of a lost physical or mental capability fits under the umbrella of assistive technology. So, for example, under my definition, eyeglasses are probably the most commonly used assistive technology. It's just that the disability in this case is so common that we've sort of forgotten it's a disability and we don't think about it that way.
Carrie Olson, tell us how you use assistive technology in your work at Front Porch.
Front Porch is a senior living provider, and so we're really focusing on the role of assistive technology in helping people thrive as they age. And like Ken mentioned, we see this very broadly as any digital tool that can help reduce friction in helping people live well. So we've explored everything from voice first to virtual reality to how social networks and social media can support and connect people, to specific apps for caregiving, to social robotics and everything in between. And what we're really excited about and what we're learning is that the key or the secret sauce in this is if you can find the point that brings an individual meaning and purpose, you can really create huge impact with almost any technology.
One of the questions we heard earlier in this episode from Harry and Marianne Wittenberg was the challenge of tech support. He has a technology background, he feels comfortable with technology, but Marianne doesn't. And they talked a bit about how difficult it might be for some caregivers to access, especially perhaps older caregivers, to access and use technology comfortable. Is there support for caregivers as they try to wrestle with new technologies?
I think this is one of the biggest areas of opportunity that needs to be addressed. There's a lot that we've been learning in our work about ways to create adoption and sustained use, and it can be done, but there is not a lot of tech support that is freely available, which is really what's needed, and paid tech support is also difficult to come by. And then there's just a proliferation of devices that generally make it difficult for everyone to feel wildly successful. I think we have to build cultures in our communities of peer-to-peer support. We've seen amazing stories. In a first community we ever deployed Alexa, the residents actually created a pay-it-forward program. And what they did was they would give an Alexa device to a friend and say, I'm giving this to you for free and I'm going to support you adopting this. And if you don't find it useful, give it back. But if you do, please pay it forward and help someone else. And it's that type of engagement that we've seen create amazing adoption and sustained use. And so I think we haven't really cracked the code, in my opinion, on all the ways we can support widespread adoption, and it's something that continues to be a major focus of our work.
So Ken Smith, tell us what you have seen happening in the world of technology for caregivers. What do you think is the most promising technology that people are using or coming down the pipe?
Well, I think that voice first has a lot to be said for it right now. I mean, it does a couple of things. It helps people, bypass the digital divide. It becomes a much easier interface to most technologies than, the typical keyboard interface or even smartphone interface that you have. And it helps both on the side of the digital divide and also on things like arthritis and just the physical aspects of trying to interact with things. In general, I think the assistive technologies that I see as being the most helpful to the most amount of people actually are like voice. They are the things that are becoming more and more commonly used by the population as a whole. Because those are the things that, first off, get a lot of use, a lot of iteration. The companies actually have to make them good, right? And then you get that scaling effect where if you're producing for a large group, the cost comes down, the availability goes up, and you really see it in a lot of places. Like I said, there's voice. Your car, right, is just stuffed with assistive technologies. I mean, it's got blind spot indicators, it's got assisted braking, things like that. I would even go as far to say that some of the platform-based service delivery kind of things that you have available to you now are another piece of assistive technology. I mean, if, for example, you have trouble cooking, you now can, pick up a smartphone or use your voice interface. You can get raw food, you can get fully cooked meals, you can get kits, you can get pretty much anything brought to you. In fact, there's a very interesting study that was done by MIT a number of years ago where they took all of the services that were provided in assisted living and broke them out one by one and figured out, could I go get those just by using things like, Uber and TaskRabbit and all of the online platform services. And the result was that effectively you could get everything you got in that assisted living for roughly the same price, or perhaps even a little less. Now, by no means do I mean that you should do that instead of go to assisted living, because of course you get this coordination, you get this expertise out of assisted living that you don't get sort of when you're rolling your own. But I think it just makes the point that you can get almost anything you need almost anywhere now.
So everything you both have described have been specific uses of general technology now. There are 53 million caregivers in this country. Are there technology companies or technology providers who are thinking about that rather large, complicated population?
In terms of solutions being developed for caregivers, there's somewhat of an explosion right now that I think many caregivers feel overwhelmed by. There's so many choices and not a clear market leader that very often it's confusing to know where to go. There is a really exciting growth in caregiving platforms where it's designed to take the friction out of coordination and communication across multiple parties, the care circle, both the formal care providers and the informal care providers, that I think a lot of people are finding incredibly valuable, especially in this time where a caregiving circle can literally span the country, if not the globe. So anything that simplifies the coordination of care, the communication, the scheduling, the status updates, I think are very, very helpful. And there's, from free platforms to paid platforms, there's quite a few. Also, those are showing up in the voice world. There are skills for that increasingly in the voice world. I think another really important phenomenon for caregivers, especially in the midst of this pandemic, is social support. So the ability to access support groups through social media or through private platforms where you can get assistance, share your needs and your challenges and get support is incredibly important. And that goes from informal support groups all the way to things like telemental health and behavioral support and formal group support for caregivers. And I think it's incredibly important because I think people have never been more isolated, and caregiving is often already an isolating experience. I think the whole explosion, again, in the pandemic in particular, of access to telehealth tools and telewellness tools are actually taking some of the friction out of caregiving. It used to be quite a burden to help get loved ones through transportation into waiting rooms, into doctors' offices to be seen, then back out. The ability to access healthcare professionals through video chat and get quality care covered through insurance is a major improvement and will change, I think, lives of caregivers significantly. Not just care recipients, but caregivers too.
So, Ken Smith, one of the things we heard from in a number of our interviews is the sense of isolation that a lot of caregivers have. The sense that they're alone, that they're not getting support. There's no community that they have access to tap into. Do you see technology changing that? Kari described some platforms that are being developed, but do you see that as a practical change either now or into the future?
I think it's a really interesting question because you can augment the communication. I mean, as Kari says, you can access a circle of people that maybe have similar concerns. So maybe you don't feel so alone that way. Certainly you can communicate with loved ones over distance in ways that you never could before. I think there remains an open question as to how much of the very human need for companionship and communication, and closeness is really helped by these tools. I mean, it's almost like saying you can cover the mechanical things in terms of the communication, but there is something about that human connection that at least I'm not convinced that you can get 100% of, sitting on a Zoom screen.
So, Kara, that's an interesting point. You work both in the virtual world with technology, but you also are responsible for physical communities at Front Porch. What do you think about what Ken just said?
Oh, I think what Ken raises is a really valid point. I'll tell you a couple things I've learned. First of all, we need to think of technology as a tool. It's not the answer, and the tool's purpose is to connect people. Okay, and it can only go so far. We're human beings. We need physical connection with one another in some form or the other. So I don't think the digital tools should ever be viewed as a full replacement for that in any means. What they should be designed to do is deployed in ways that reduce the friction, where it's difficult to get those physical touch points and where you still want to create connection. I think it's approaching and properly positioning them in the ecosystem of care. But I'll tell you, one of the most interesting things, we do some research in our Center for Innovation and Wellbeing. And when we first deployed Alexa, we were one of the first in the country to deploy Alexa in senior living. And one of the questions I personally had was, would this make people feel more connected or less connected? And I think the overall concern was they would feel less connected. And we were astounded when we got our first set of results, where 71 of the participants in the pilot using Alexa felt closer to family and friends and loved ones in their community and also outside because of the deployment of Alexa. And when we dug deeper into that research, what we found is that it was exactly what I described. Alexa was reducing the friction and increasing the type of contact, the frequency of contact that they were having with people they cared about. In fact, the residents in the pilot had figured out on their own how to use the Alexa calling feature, and they were calling each other like, hey, I'm going to dinner now, come with me. Hey, we're going to do bridge in 303, come over there. And it was those quiet moments that would otherwise happen, but where it created a pathway for more connection that really improved quality of life.
Carrie Olson is the Chief Innovation Technology Officer for Front Porch and President, Front Porch Center for Innovation and Wellbeing. And Ken Smith is a Senior Research Scholar and the Director of the Mobility Division at the Stanford Center for Longevity. Harry Wittenberg passed away last week from complications due to ALS. Before he died, Harry wrote what he called a living eulogy, a first draft, on his website. As I have expressed throughout my writing, he said, it's not me alone who should feel a sense of urgency to live to our fullest purpose and joy. We should all guard against complacency in the mundane, because we can't tell when adversity might visit. Here's how Harry ended his living eulogy. When I end each segment with more to come, I mean it. I'll keep posting on my blog as long as God and my body will allow me. At the time I have to say, that's all, folks. You'll be the next to know after my family and friends. Thanks for hanging with me through my journey. And thank you, Harry, for taking us on this journey with you. You've been listening to When I'm 64, the podcast for caregivers. I'm Ken Stern.